Welcome, everyone. We're about to start the last and final segment of the Let's Talk About Economic Progress series. My name is Wayona Nelson Davies, and I'm the Executive Director of the Economic Progress Institute. I would like to thank our 25th anniversary presenting partner, Blue Cross Blue Shield of Rhode Island, and our national partner, Family Values at Work, for sponsoring this series. We launched this series during our 25th year of progress celebration to highlight our national partnerships and the intersections of issues that are important to the mission of EPI. We started the series talking about the care economy, and then we move on to equitable revenue. Today, we are going to bring it all together and talk about budgets and policies and the way budgets directly impact issues we care about, from the safety net to housing, education, living wage, healthcare, childcare, workforce development, tax credits, support for small businesses, and so much more. I am humbled and really excited that we get to have a fireside chat with none other than the budget and policy legend, Sharon Parrot. And Sharon, come off camera while I introduce you. Thank you, Sharon, for joining us. I'm going to give a brief bio of Sharon, and then she's going to join me for our fireside chat about budget and policy. Sharon Parrot is the president of the Center on Budget and Policy Priorities. She has deep expertise in policies to reduce poverty and expand economic opportunity, the intersection of federal budget on low-income programs, and the use of data and analysis to inform policy debates. Sharon has spent nearly 3 decades with experience at the center and in government because she started this work when she was 1 year old. Some highlights of the woman who has done it all. Sharon has worked in the Office of Management and Budget as the Associate Director of the Education, Income Maintenance, and Labor Division, with budget and oversight responsibilities for the Departments of Labor and Education, the Social Security Administration, the Human Services programs of the Department of Health and Human Services, and nutrition programs at the Department of Agriculture. Sharon has also served as a counselor for human services at HHS and as a lead advisor on human services issues, including programs for low-income children, children who have been maltreated or at risk of abuse, seniors, and people with disabilities. At HHS, she worked on including early education, temporary assistance for needy families, TANF, child support enforcement, child welfare, teen pregnancy prevention, community supports for seniors and people with disability, and the intersection of health reform and human services issues. She has dedicated her work to focus on the impact of budget and tax policy on efforts to reduce poverty and hardship and promote economic opportunity. The legend is here with us today. Please join me in welcoming Sharon. It's such a pleasure to have you here, and I'm going to jump right in. Thank you for accepting our invitation to join us in Rhode Island, even though it's virtual. We're happy to have you.
Well, it's lovely to be here, and thank you for that overly kind introduction that gives lie to the idea that I started this when I was what?
Yes, you have done a lot, and for us in this work, we really value all of the impact you've had. So I'm going to start. As you know, we're celebrating 25 years of economic progress here in Rhode Island because our organization has been around for that long, and we're really proud of the growth. And the Center on Budget and Policy Priority has been a critical national partner and has provided us access to a network of other state partners fighting for racial and economic justice. It was really important to invite you to join in the celebration and a call to action to continue to protect the progress we've made and to be bold in creating transformational policy change. And so I'm going to dive in as we think through this lens of progress we've made. We've been thinking a lot in our celebration about the legacy of our co-founders, Linda Katz and the late Nancy Koretz, and really thinking about the why in creating the Policy Institute, which is now the Economic Progress Institute. We know that they wanted to create an organization that put people first, those who are often forgotten when we create policies. And we continue to uphold their legacy today. And so I want to start there with you, talking about legacy. You are a legend, and probably you're embarrassed that we're calling you a legend, but you are, right? You are a legend to many of us. And so if you were writing your story, what would you want your legacy to be? What's your why?
Yeah, thanks for that. Yeah, I am embarrassed by using that word, so maybe we won't do that anymore. When I think about what does it take to create change, because what I have spent my career doing is trying to impact positive change, trying to bring us closer to a country that meets the values that we want to believe our country rests on, right? That everybody has the resources they need to thrive. And so when I think about what does it really take to drive that kind of policy change, I come back to over and over again that it takes a robust and highly diverse progressive ecosystem with people, with organizations and people playing different roles, using different strategies and tactics, but rowing in at least roughly the same direction of progress. But not exactly in the same direction, because we need to challenge each other, right? And evolve together and be able to course correct. And so we don't, but broadly, right? We need a broad set of actors that are driving toward positive change that makes economic and health security and true opportunity the reality for everyone, regardless of background and regardless of identity. And so then I think about what's the role that the Center on Budget and Policy Priority plays? Because we need lots of actors, right? We need organizers, we need faith groups, we need people with lived expertise telling the truth about life in their communities and what is needed to make this country more just, right? We need groups that focus on individual kinds of populations like kids or people with disabilities and seniors. And we need people that zoom out and take the big picture. So what is our lane? And there's lots of things that we do, but fundamentally we are trying to kind of merge high caliber research and analysis so that even if you don't agree with us, you kind of believe that our numbers are right, right? High caliber research and analysis, strategic insight, right? We're not trying to write a report that sits on a shelf. We're trying to drive change. Strategic insight, strong communications, a willingness to actually be in the advocacy world, right? To push, and our partnerships, right? And that fundamentally we are at our strongest and our most impactful when we are serving this broader progressive ecosystem so that more groups, more people with lived experience, more communities can engage in the policy decisions being made both at the federal level and the state level that affect their lives and their communities. We can provide policymakers important data, and we do that. But the power comes when a whole host of actors take that data, combine it with real stories, and communicate powerfully at the right moment to their policymakers. The second thing I would just say is that the other thing that change requires is a belief and an articulation of the big things we're trying to achieve. What are the big goals? What are our North Stars, right? Health coverage for everyone. Everyone has access to a home in the community of their choice that they can afford. No one lacks for food security. Everyone has access to opportunity, right? What are those North Star goals that we know we're not going to achieve in one step and in 1 year, but that everything that we do, whether it is seizing a small opportunity to make a small change that's positive, whether it's seizing a bigger opportunity to make a bigger step forward, or whether it is holding back those that want to take us backwards, that everything we do is in service to those big goals and that we can hold both of those things. And so I think that when we articulate a bold vision, when we work doggedly in the here and now to make the progress we can achieve and to hold back going backwards. And when we can do that in a way that brings in more people, in a way of true shared power where we're setting priorities together and strategizing together, when we can play those roles, that is when we are building our power to the and maximizing our effectiveness. And so I hope that is what we are driving toward as an organization and what we look back on with pride that we were able to achieve.
No, thank you. That's powerful and that's needed now, especially in Rhode Island. We're at the end of our budget and legislative session. And it's a time where, you know, the budget was just released last week. And so people are like happy with some things, but then we didn't go far enough, right? So people get discouraged and saying, but we tried so hard and we just made one step forward. And so it's important to hear that message that those step forwards towards that North Star is where we want to go, because we want to transform Rhode Island, we want to transform the US, and every time we show up together, right? So that building people power piece is really important to this work too. So thank you for reminding us, because I'm sure my colleagues in Rhode Island who are on this call needed to hear that we are powerful together and we are still going towards our North Star, and we're going to celebrate the wins along the way. So thank you for sharing that with us. And the second question is a little bit along those lines. You know, again, we've been reflecting a lot, 25 years, you know, we've made some steps forward and sometimes not far enough. So I want you to sort of maybe take us through, you know, in Rhode Island, we've improved child care, we've helped improve the minimum wage, we've improved tax credits, not to where we wanted to get, but we're getting better understanding of how that can help reduce poverty in Rhode Island and in the United States. But we know we have a far way to go. So from your perspective, as someone who has worked in government and someone who is leading the center, where do you see us making progress as a nation?
Yeah, it's a great question. Let me just put a pin on something that you said about we made progress, but it wasn't enough. Of course it wasn't enough, right? And that's what drives you to come back next legislation and get the next win, right? I often say, if you got everything you asked for, we didn't ask big enough, right? And so some years you make bigger steps forward, and some years the opportunity set is narrower. But the important, as you said, the important part is to keep showing up and keep pushing and keep making steps in the right direction. So when I think about the country as a whole, there are areas of tremendous progress. And I think that for those of us whose job it is to wake up every day and think about how do we go further and to think about the ways that the country falls short, it can be easy to forget that we have made progress and yet not nearly enough. So let me try to lay out three things that can all be true at once. So the first is that if we take the long view and we think about the last 40 or 50 years, we have made significant progress in things like reducing poverty. And we know that when we reduce poverty, that has long-term positive effects that changes people's lives in important ways. We've made tremendous progress reducing poverty and expanding health coverage. So just like one stat to try to keep that in your head, in 1970, our economic security policies, the kinds of ways that we support families, only lifted 8% of people whose private incomes were below the poverty line above the poverty line. So we had a very weak safety net. And if you looked at people whose own income put them below the poverty line, we only lifted 8 out of 100 of those people above the poverty line. In 2022, after nearly all of the pandemic measures had expired, our economic security policies lifted almost half of people whose private incomes put them below the poverty line above the poverty line. Now look, half remained poor. It is not a finished job, but it is important to recognize the progress, in part because it's really hard to make further progress if you don't acknowledge what's worked in the past.
Right.
In health coverage, a very similar story. In the 1970s, Medicaid was a tiny program that was really only for people who got cash assistance through various programs. We had no Affordable Care Act marketplaces. If you didn't have coverage through your employer, you were very likely to be completely uninsured. And today, Medicaid covers well over 85 million people. It covers over 20 million people in the Medicaid expansion that happened in the Affordable Care Act. And in this past open enrollment season, 21 million people signed up and got coverage through the Affordable Care Act marketplaces. Almost all of them were getting subsidies to make that coverage more affordable. So that is tremendous progress. That is tremendous progress. And at the same time, this is the second thing to hold as true. We have not achieved economic health or racial justice, not even close. So in 2022, 40 million people in the United States lived in families whose incomes were below the poverty line. That should shock our conscience, right? About 9 million of those people were children. The poverty rates are highly unequal across lines of race and ethnicity. So among children, about 1 in 14 white children have incomes below the poverty line. But it is about 1 in 5 Black and Latino children. So both our overall level of poverty and the glaring inequities by race and ethnicity are shameful and are the thing that we have to keep working towards. Similarly, we've made progress on health coverage, but 26 million people in 2022 lacked health coverage. Now we know that we can make progress. We just saw it in the pandemic, right? We took seriously the idea that we were going to protect people from economic hardship and to get health coverage to people because during a pandemic that seemed important. And we did it. Uninsured rates plummeted, and we saw poverty rates that we have never seen in this country. They were so low. And the truth is that we can have a robust child tax credit. We can have broader access to Medicaid. We can maintain the expanded premium tax credits that make marketplace coverage more affordable. We can expand access to housing assistance so people can afford to homes in their communities. We know what works to do it. We have to find the will to do it. Now, the third thing I just want to say is that it also matters a lot what state you live in. In the United States, states have enormous power. They have enormous decisions to make about who they invest in and what revenues they raise. And so the circumstances, the opportunities, the ways that we do or don't protect people from really serious hardship is very different if you live in Rhode Island or if you live in Texas or Florida or other states. And so that is a hard issue. It is creating broader inequities across state lines, and it has a racially disparate impact also. And so as we think about making progress going forward, there's this incredibly important role for states to play. And at the same time, how do we think about more robust federal policies so that the most basic question of whether people can afford to make ends meet doesn't depend on your zip code? So I'm happy to talk about the roles that the federal and state governments can play, but why don't I stop there?
Yeah, no, thank you for that, because first of all, I just want to thank you for grounding us, because again, when you're doing this work year in, year out, there's frustration along the line, right? And there's like, how do we keep going? And so really grounding us in how far we've come. And show that because of advocates, because of legislative champions, because of people really pushing for change, we've had change. It's important grounding for people doing this work and for impacted communities to say, don't give up. We have made change. So it's possible if we've done it before, we can do it again. So thank you for that grounding. And then also this idea of the role state can play and the role federal government can play. You touched on some policies that through the pandemic, we saw worked to really address economic security in the US. Tell me a little bit more. Are there any specific of what can be done? Because even when we meet with our leaders, they say it's overwhelming. The budget can't cover everything, or it's overwhelming. We can deal with this policy now, even though part of our job is providing policy recommendations, making sure communities are talking about solutions. So what can our leaders, both on the federal and state level, really do to say, we know what worked, and why aren't they doing it?
Yeah. So we do know it works and we do know what's required, right? What's required is a willingness for us to raise revenues that we can then use for high impact investment. And that's true at the federal level, and it's also true at the state level, right? So we are a wealthy country. In fact, our wealth is almost unparalleled in the world, although not entirely, but among large countries, we are an incredibly wealthy country. And that means that we can afford to make the kinds of investments that, frankly, other countries make,
Mhm.
right? Almost all wealthy countries have some kind of child allowance that is robust, that provides meaningful support to families with children, that protects children from poverty. Most other countries uh, have uh, have paid leave policies. Other wealthy countries have paid leave policies, national paid leave policies. So Rhode Island is to be congratulated, right? An early adopter in paid leave, and it's not perfect. And I know you guys have the next 3 things that you want to change and improve about your paid leave policy, right? And so states like Rhode Island can show the way both to other states, which is certainly a role that Rhode Island has played, right? Showing that paid leave is possible and other states have now come behind you, but also nationally, right? Um, we can have an unemployment insurance system so that when people lose their jobs, they have enough financial security so that they can take a look for another job, find a good fit job, and not have a temporary period of unemployment spell financial catastrophe for their families. Other countries do that.
Mhm.
We can invest in the care economy so that parents have high quality places that are affordable to take their children while they're working. And so that when people have caregiving responsibilities for older family members or family members with disabilities, that we can meet those needs. Those are things that are important in the lives of families. They're critical for child well-being. They're critical for launching children successfully into their adulthood. And they are imminently doable, but they do require us to prioritize those needs and be willing to raise revenues to make those investments.
Mhm.
Now, both the federal and state level, federal and state governments have an incredibly important role to play. When the federal government acts, it can affect 100 million people at one time, right? And it can reduce those differences across state lines. States have a role to play because certain things like education and childcare require state engagement. And in the absence of all the right federal policies, states can show the way if they make good priority decisions. Uh, and so our job is to show both that it is possible to raise revenues and what those high impact, high value investments are. And then to show that the country or the state or communities will be better off if we raise more revenues and invest them wisely than in our current low revenue, low investment national kind of political policy stance. That what that leads to is underinvestment that shortchanges people's opportunities and therefore robs the country as a whole of people's fullest potential that gets shortchanged because we leave them mired in poverty. We don't invest in schools. We don't create opportunity.
Yeah, makes sense to me, right? You would think like, oh, Sharon said it, like just do what Sharon said. Like that's what I need to have a sign. Did you hear her do what she said? Because the answers are here. And so again, we're hoping, our leaders are listening to some of this. I'm going to shift gear for a little bit, but I want to remind the audience that please, we want you to be a part of this conversation. So please post questions for Sharon in the chat, and we'll get those to her after this conversation. So I want to shift to sort of what's on the horizon for us. This is an election year. And then we also know that in 2025, and I'll ask you to go in depth about what is happening in 2025, we deem that a consequential year with critical policies at play. So there are concerns about this election year and impact it's going to have on those critical policies in 2025. So tell us a little bit about what do we see on the horizon as a nation come 2025 and beyond that can have significant implication for equity and justice.
Yeah, thanks for that. So I'm spending a lot of time thinking about 2025. Um, a lot of time thinking about what are the key policy debates that we are going to be engaged in regardless of the outcome of the election. And then what is the landscape of risks and opportunities, which is heavily dependent on the outcome of the elections. There's just no way to get around that. So one of the first things I want to sort of focus on is that at the federal level, there are key policy decisions that have to get made in 2025. Congress has set for itself a whole series of deadlines that are all in 2025. And so regardless of the outcome of the elections, right, regardless of whether it's a Democratic trifecta, a Republican trifecta, we have divided government, regardless of those outcomes, Congress has a series of decisions to make. And again, the risks and opportunities we face will depend in part on the outcome of the election. So let me tell you about 5 key decisions Congress is going to have to make next year, and then we can talk a little bit about some of those risks and opportunities. So the first is that the country, for reasons that are quite unfortunate, has something called a debt ceiling. And so periodically, Congress has to either raise or suspend the debt ceiling. Otherwise, the federal government loses the ability to borrow and can't pay its bills on time, and it defaults in meaningful ways on its debt. We last addressed the debt ceiling in 2023 when Republicans, quite frankly, tried to use the debt ceiling as leverage to push through highly unpopular, highly problematic cuts in a whole range of areas, including basic economic supports and health supports for people with low and moderate incomes. They mostly didn't succeed entirely. There were some cuts that were made that were quite problematic. So next year in 2025, sometime likely between the spring and summer, we don't know exactly when the hard deadline will be, Congress will have to act to either raise or suspend the debt ceiling so that the federal government continues to be able to pay its bills. That opens up the possibility of debt ceiling shenanigans, as I like to call them, where the potential for some policymakers to say, we're not raising the debt ceiling unless you meet a series of demands that are not about raising revenues, which would be the best way to approach deficits and debt, but instead by really attacking core supports for people who need them. So the debt ceiling is going to be an important moment, and a moment that has both risks associated with it. The second is, as you probably heard about, big pieces of the 2017 tax law expire in 2025. It's important to know the pieces that don't expire. The enormous corporate tax cuts that were enacted in 2017 were the Republicans' top priority and were made permanent. What was made temporary were a series of tax cuts that were themselves skewed to wealthy people, but affected a broad swath of households at the individual level. And it is mostly those individual side tax cuts with a few business tax cuts that are due to expire in 2025. Taken as a whole, the 2017 tax law was skewed towards the wealthy and profitable corporations. It was very expensive, and extending it will cost $3.5 to $4 trillion if all of those things were extended and weren't paid for. And they failed to deliver on the economic promises that their proponents put forward. So they're starving us of resources that is limiting what we are willing and able to do in terms of high value investments. And it is not paying off in economic growth or more broadly shared prosperity. So the 2025 tax debate offers a moment, right, to course correct. It offers a moment to say, we need to raise more revenues. We need to reorient our priorities to people and communities that aren't already wealthy, that aren't profitable corporations that find all kinds of ways to skirt paying taxes. And so the 2025 tax debate will be an important moment. It offers enormous risks, right? That everything just gets extended and our revenue base continues to be eroded. And it offers real opportunity to course correct and to use revenues for high impact investments. So that's the tax debate. That's the second. The third is that the premium tax credit expansion, which is a mouthful, but the financial subsidies that make the Affordable Care Act marketplace coverage more affordable, that was expanded. It was expanded first in the rescue plan during the pandemic, and then later in the Inflation Reduction Act. Though that expanded financial support for coverage expires at the end of 2025. If we're going to maintain this incredible momentum towards more coverage, we've got to keep that expanded premium tax credit that has kept coverage costs so low. The fourth thing is that the Farm Bill was actually due in 2023. Then they tried to do it this year, kind of. Looks very unlikely that it will get completed this year. And therefore, the Farm Bill, which has a whole host of agriculture policy, but also is where the our biggest food assistance program, the SNAP program, has to get reauthorized. And so again, that gets kicked into 2025. And there are opportunities to improve SNAP and risk that that policymakers will be trying to cut SNAP. And the final thing that Congress has to do next year is the thing they have to do every year, which is write funding bills. And next year, there is no preset agreement on the top line, the kind of overall amount of funding for those programs that go through the annual appropriations process each year, those non-entitlement programs. And so Congress is going to have to make an agreement and then try to come to an agreement on funding bills, which has proven difficult for this Congress. And that kind of overall funding for non-domestic investment is often something that Republicans try to beat down, to try to get cuts to in the context of a debt ceiling. All of these debates are highly interrelated, right? How much we raise in revenue and how much we're willing to spend are highly related. And so it will be a highly consequential year at the federal level. Now, you are the expert on the kinds of debates you will see in Rhode Island. I will tell you that when we look across states, we see that many states are likely to have highly consequential legislative sessions in 2025 as well.
That's important to note. I know we've been, one of the things you mentioned with the premium tax credit, one of the bills with our Protect Our Healthcare Coalition is trying to get a working group through Health Source RI that really manage our marketplace here in Rhode Island to really study how that will impact Rhode Island. We're not sure if that's going to get passed, but that's an important conversation we're starting to have to see what protections we need to do at the state level. Raising revenue is another huge movement here. And I say movement because a lot more people are understanding the tax fairness of it, why this is important for investments. And so we've really been working and growing that movement and coalition. And I think legislators, there's been momentum in the General Assembly around revenue. We need to talk about revenue. We need to plan for revenue. So it's important for us to keep our eye on what's happening in 2025 at the federal level and make sure we're doing our part on the state level to either support or lend our voice to those issues because they will impact us here in Rhode Island and across the country. So thanks for sharing that, and hopefully on the call we are getting some call to action for what we need to do. I want to move on to priorities because we talk about a lot, and even at EPI, journalists joked earlier that our priority list was, of course, long because everything economic justice were there, right? Because we understand the intersection to all of this. And it's really challenging. It's challenging to prioritize what policies we need to push to eliminate poverty and what policy we need to push to achieve economic opportunity. So every year that lists grow longer. And you're leading the center that also have an expansive list that look at everything from low income to different levels of economic opportunity. And so when you think of all we have to do, including what's happening in 2025, what would you say the pressing budget and policy issues are of our time, and how can we work together to achieve the goals we have?
Yeah, it's a great question. And I do believe in prioritization in the moment, like in a legislative fight, when the parameters of the debate are what they are and you need to prioritize, understanding what your top priorities are and matching that to political reality is hugely important. And at the same time, right, At the same time, it's really important to not pretend that somehow childcare is important to families, but being able to afford the rent isn't. The reality of families' lives are that they need to be able to have they need to have access to affordable housing and affordable high quality childcare. And we can't wish that away because in a particular political moment, maybe we have the opportunity to make progress in one and not the other.
Mhm.
So I just want to take a little bit of a step back and ask kind of the broader question, which is like, what are we trying to achieve? For me, and for the center, one of the ways we articulate what we're trying to achieve is a country where everyone, regardless of background or identity, where everyone has the resources they need to thrive and share in the nation's prosperity. That is ultimately what we're driving toward. And so then the question is, well, what does it mean to thrive? And I think this is really important because thriving is not barely scraping by. Thriving is not, this month I'm not going to get evicted. Thriving is not, well, I'm not going to pay that credit card bill because I need to pay my car payment so my car, I have a car to go to work. That's not thriving, right? Thriving is having the resources you need so that you can invest in your own opportunity. You can invest in your kids. You have a modicum of security, which allows you to take risks and to plan for the future, right? Thriving is really different than scraping by. And thriving is what allows people to set their own dreams and goals and work to achieve them. And so, what does it take to thrive? And I'm not going to pretend that the only thing that matters is economic and health security, because that's clearly not the case. But in the realm of economic and health security, what people need to thrive is enough resources to afford what their families need. And that can come in a lot of different ways, right? A child tax credit provides income that allows people to buy what they need. Housing assistance helps with the single largest budget item in most families' budgets, which is housing, right? A child care subsidy or cash assistance, they can both be used for families to have what they need. And ultimately, my own preference, right, would be to give people the kinds of assistance that gives them the maximum amount of agency in terms of choice. And at the same time, we live in a world where there are political realities, and maybe doing assistance in different ways helps us maximize the help we're giving to families. And so if we really stay grounded in what do families need to thrive, I think it allows us in any particular political moment, any particular legislative session, any particular fight to evaluate what is the art of the possible, recognizing that this is the North Star. What is the art of the possible, right? And how can we maximize what the kinds of help that we get to families that matters for them thriving. And so we can make the kind of trade-offs in the moment that the politics require, but we should stay really focused on that North Star of what families need to thrive, and just make sure that every time we're making a priority choice, this maybe in this legislative session, our best shot is childcare. And we know childcare is a huge need for families. And so we're going to go all in on that. And then maybe next legislative session, we'll focus on something else. Or in this legislative session, we're doing a tax bill. And so things that most naturally fit within a tax bill has real resonance. So maybe this is our year for a child tax credit, right? And that's so important for people to thrive, right? As long as we stay focused on what families need to thrive and are listening to families who articulate what they need to thrive, we can make those priority choices in the moment so that we can be relevant in the debate of the day and still maintain our commitment to that broader North Star.
Thank you. You're dropping some gems on us, Sharon. I'm taking notes because the idea of our why, right? Like, why are we doing this for families to thrive? And that art of the possible. I love that because I think we do that, but we don't realize that is what we need to do and see. And so to really focus our energy on that why, continue to push towards making sure families can thrive. So thank you for sharing that. And I'm probably going to use it. So if you hear me quoting this and pretending I'm used somewhere, don't call me out because I really like the way you frame that message for us. And then I have one final question for you before I invite the EPI policy team to share what we're doing here in Rhode Island and how we're connected to the work you're doing. Again, you've shared, we've come far from where we were, and we're also still far from where we want to be. And you've been doing this work for years, and people always ask me, like, how do you keep going, right? And so I really want to know, because I think that helped us to find out from people who are in this for the long haul. What do you look to for inspiration, for hope, that all of what you said, that North Star of every family in the US thriving is possible? What's your inspiration and hope?
Yeah. So first I want to acknowledge that it is hard, right? It's hard to look out in this moment to see anti-democratic forces that are trying to undermine the basic tenets of our democracy, to see mean-spirited proposals that are meant to tear people down instead of lift them up. The terrible rhetoric that we hear, I promise I'm going to get to the hope and optimism, but the terrible rhetoric that we hear around, you know, every racist trope around work and why people don't, why people are out of work or lack economic security. It can be very dispiriting. And I say that because I think too often we don't allow ourselves to acknowledge that these moments are hard. And right now, I think we've had many hard moments over the 30 years that I've been doing this, and this is a hard moment. And I think election years are always sort of hard, and this one is particularly hard. And so then, how? Like, how do you kind of keep, somebody talked about, how do you keep pushing that boulder up the hill? And for me, who's a data nerd and also someone who really loves stories, for me, it is recognizing that when we zoom out and we see the long arc of progress that we have made, and then we get behind those numbers, like, what does it mean that we lift so many more people out of poverty today than we used to? That's not just a number on a spreadsheet, right? That represents people whose lives have been changed, who had greater opportunity because their families had more economic security. Wasn't perfect, isn't perfect. We leave far too many people behind. But when we think about the progress we have made, and we think about what's behind that, and the kinds of impacts that we know from research and data, right? The kinds of impact that has on people's lives. That coupled with the knowledge that we are privileged to be able to point to policy fights that we have been in, where we have made positive progress that has mattered to people and communities, and that we have stopped terrible things that people wanted to do that would have moved us backwards. And that both of those things, the steps forward that are big, the steps forward that are small, and the stopping of things that are damaging, all of those wins have mattered to actual people and communities. So that, coupled with the knowledge that the progressive ecosystem has expanded and that we have found exciting new ways to bring more people into these debates, particularly people and communities themselves, to have a say in the policy decisions that affect their lives. The combination of progress that we have made, progress being possible, and that the tactics, the strategies, the how we do the work has evolved in such important ways. Those are the things that really give me hope going forward.
Yes, no, thank you. I agree. Lives have been changed. And I think for most of us, that's the why, to see that you're having impact on people's life. And also, I'm inspired by people like you. I'm inspired by the people we get to work with in Rhode Island. And I'm inspired by the EPI team. And so it was important as we end this series to really share the light with the people who are here and committed to this work and want to do it because they care about the progress we make. And so with that in mind, thank you again, Sharon, so much for joining us. You share a lot today, a lot for me to even think about, and hopefully for us to think about in Rhode Island. And then I want us now to shift a little bit and have the policy team join you and sort of connect between a lot you talk about in the national movement and what's happening in Rhode Island. So I would like to invite out Nina Harrison, EPI Policy Director, to get us started, and she'll bring up the rest of the policy team.
Hi, Sharon. Thank you so much, and thank you, Wayona. Um, so I was applauding off camera, listening to some of your talking points because I think they do match so well the policy priorities that EPI has historically had and has had this year, um, which focus on the areas that people need to actually live their lives. So EPI's policy priorities, we focus on making sure that everyone in Rhode Island has access to affordable and accessible health care, like you discussed, that people need access to affordable and quality childcare. Um, but and while EPI hasn't done much housing work in response to urgent calls of need from the community, we did endorse a bill for a rent cap this year for state rent because there was such a high rent increase for the city of Providence, record high in the country. We also champion other things like early education and investments in quality early education for the children of Rhode Island. We believe in supporting our workers, so making sure that we're advocating for policies that mean that workers can live a full life and have the supports they need, like a living wage, um, like adult education, and something newly added to our agenda this year, which is investment in multilingual learners. Because, again, if we're not educating either our young people or our adults properly, how can we expect them to be able to have economic opportunities that they need to support their families? Um, We also support other economic opportunity tools for families like cash assistance. And many of these things that we advocate for are found in the state budget. So, in our state's budget, here at EPI, we're advocating that the budget reflect the values that we represent as an org and that we believe Rhode Islanders hold as well, which is for fairness, to support families and children and the health and well being of not just families and children, but elders and all Rhode Islanders. Um, we also play defense to a degree in terms of stopping predatory practices, trying to make sure that, for example, payday lending, which charges upwards of 260% interest rates, um, is a practice that we get stopped in Rhode Island because it is targeting and harming vulnerable low income individuals and sending our money straight out of our state instead of having it circulate in the state economy. We also focus on race, equity, and democracy. Wayona warned you all that our policy priorities were long. And really, we look at all of our policies with a special attention to race and equity, just because we know it's so easy to make huge mistakes if those critical aspects of analysis are overlooked. So we look at all of our policies in terms of how will these potentially reduce and and or eliminate racial disparities and other disparities for historically marginalized communities. Regarding democracy, we advocate for a full and robust democracy and as many people having access to their right to vote as possible. And then finally, there's the budget, revenue, and tax fairness piece, which is kind of all encompassing. Many of the policies we promote require money, and that requires state revenue. And even once you have state revenue, that requires politicians to put allocations in the state budget for the programs that we have deemed critical for the well-being of Rhode Islanders. And so we, one such example of how we promote tax fairness is the millionaire's tax, um, because we believe that wealthier Rhode Islanders should pay their fair share. And unfortunately, low-income Rhode Islanders are paying a higher percentage of their income in taxes than are their wealthier counterparts in Rhode Island. And so this millionaire's tax, for example, could fund public education, roads, in bridges, public transportation, and childcare, all of which are areas that have really suffered from lack of sustained investment at the state level and have resulted in several crises, whether it be a workforce shortage in the childcare sector or a bridge that's on the verge of collapse that's really affecting people's commutes in our economy. So that is a lot of stuff that we work on, and I'm really grateful that we have an amazing team to do all of this policy work with us. So I'd like to ask our policy team to come on camera to introduce themselves. We have Alan Krinsky, Director of Research and Fiscal Policy. I'm going to introduce them all and then invite each of them to explain a bit about why this policy work is important to them. And I can just say that I think I'm most proud of the passion and commitment that everybody on this team and everybody at EPI has to the work, has to uplifting humanity, and really just, I think, fighting for what we all think is goodness, which is making sure that people can all not only get by, but thrive, and that we're fighting actively against opposing forces that may have different priorities. So we have Alan Krinsky, the Director of Research and Fiscal Policy, and actually I'll just let you, or shall I introduce everyone?
I'll go. Thanks, Nina, for your remarks, and thank you to Wayne and Sharon. And I'll just say, I've been with EPI a little over 5 years now, and having the support of the center and its state priorities partnership network of organizations across the country like ours has been just a really wonderful thing, wonderful opportunity to interact with colleagues, to get information and data, to go to the conferences and get that kind of support. Has really been a incredible part of feeling like I'm part of a national community, in addition to the community here in Rhode Island. And I'd say what I want to raise, I think that Wayne and Sharon, you discussed this in the conversation or hinted this, is what I really love about EPI is this balance I think, successfully achieve between working on incremental change, small changes that will benefit people. Something like last year, the earned income tax credit was increased from 15 to 16%. Not a huge jump, we figured not even $30 a year, but it's something still for someone who might be for working families. And so the balance between that incremental change year after year we're working on, and also the transformational change that we're working at, and trying to get the ITC, say, up to 30% this year, and working on both of those at the same time, all the time, and seeing those incremental changes, sometimes even seeing the transformational changes, and on something like, say equity, to try to get legislators, policymakers to think about that more often. That's what I really value about the work that we do at EPI.
Thank you, Alan. And next we have Divya Nair, who is a policy analyst with EPI working on paid family leave and government support programs.
Thank you. You stole one of my lines. Yeah, I'm a policy analyst. I work on children and families policies such as paid family leave. Really appreciate the shout out to that during this conversation, childcare and cash assistance. And so one of the reasons why I am so passionate about these policies is that I believe that they're really the foundation for a just economy, one that works for working families, and that healthy and thriving communities need all of these policies in order to thrive. And so I'm also a social worker by training, and so I have a deep confidence in communities and people being the experts in their lives. And I think EPI is really one of those organizations that works really collaboratively with nonprofits and community organizations throughout Rhode Island to move progressive policies. So I'm really happy to be here and happy to be a part of this work.
Thank you, Divya. And next we have Hector Perez Aponte, Racial Justice Policy Analyst and our newest policy analyst at EPI.
Hi all. Yeah, I'm very happy to be here at EPI. I'm so happy to be a part of a wonderful team that's dedicated towards fairness and economic justice for all. Um, like folks across our communities, I've experienced firsthand the economic disadvantages imposed on people because of racist laws and policies. I believe that here at EPI, we are working towards empowering communities and taking action against these disastrous, dangerous laws that are impacting folks. And I believe that robust policymaking decisions require comprehensive analysis. But more importantly, I think our communities should have access to tools for change. And I'm very happy to be a part of this team, and that is why I'm here.
Thank you, Hector. Okay, and next we have Kavya Gopinath, State Policy Fellow, working on worker justice issues and tribal policy, state tribal policy.
Hi, thank you everyone so much. This has been such a great talk. I wanted to say that I do this work because I believe in transformational policy that centers groups of people who have been purposefully excluded from economic progress for generations. And I really appreciated what Sharon was saying earlier about the difference between thriving and just being able to meet your basic needs. And that at EPI, we really believe that all Rhode Islanders deserve opportunities to thrive. And it's just super exciting to be part of an organization that really pushes to make that happen.
Thank you. And in terms of my why, I'm sorry, I'm pausing because I think ever since I've been a child, I have just always had a really deep sense of justice, and that involved community. It involved helping people who needed help. It involved me seeing examples of adults in my life providing help unsolicited, freely, and lovingly, and seeing how transformative that kind of help and those tools can be, and also seeing serious gaps where those tools weren't provided and how destructive the consequences could be. So I'm a big believer in efficacy and love, and I know how effective loving policies can be at transforming a state for the better. So I'm honored to be able to do this work. I'm honored to be able to work with such a great policy team, such a great executive director, and I would like to welcome Sharon back for some closing remarks.
Thank you. I think I will just close by saying that the Economic Progress Institute is such a valued partner of us at the center. As Alan referred to, we coordinate and support a network of 42 organizations. We're in 40 states, DC and Puerto Rico, and the Economic Progress Institute is part of that network. They're independent groups. They do remarkable work, often with constrained resources. They are true essential infrastructure in their states, driving policy change in their states. And when the call goes out that we need help and engagement in federal policy, they are right there with us. So I'm just thrilled to have been able to be here with you today, and more thrilled that we get to be in partnership with the incredible leaders at the Economic Progress Institute, Wayona, Nina, and all of the policy staff, and are deeply grateful for that partnership. We know that we cannot move policy alone. This is a group effort, and it takes many, many hands to move policy, whether it's in a state or at the national level, and we are so grateful for the partnership.
Thank you again, Sharon, for joining us. Thanks to the EPI policy team for all your hard work, and to our partners that make this work possible. So to you, I say onward, and we're going to continue talking about these issues and continue pushing for policies that will help families thrive. Thanks to everybody. I'm full. Thanks.